Hi, I'm Garvin. So this telecast is on diabetes. So how does Lynchs Pharmacy help if you've been diagnosed with diabetes or have diabetes? So here at Lynchs Pharmacy, our goal is to improve the consistency and accuracy in how you take your medicines. According to the World Health Organization, as your understanding of your medicines improves, your overall health will also improve. So here on this website, we provide you with everything you need to know about diabetes, from what causes diabetes to how to better live with diabetes. We also provide easy to read and in plain English information on all your diabetes medicines and the different types of insulins available. We also have videos explaining your medicines and insulins, plus demonstration videos on how to use your blood sugar machine and videos on how to correctly inject insulin and how to correctly use the glucagon injection. So just click on your medicine and watch your video. If you have any questions, you can ask us using our live chat on the website. So next, I'll just give an overview of diabetes. There are two major types of diabetes. In type 1, formerly called juvenile onset or insulin-dependent diabetes, the body completely stops producing any insulin, a hormone that enables the body to use glucose found in foods for energy. People with type 1 diabetes must take daily insulin injections to survive. This form of diabetes usually develops in children or young adults, but can occur at any age. Type 2, or formerly called adult onset or non-insulin dependent diabetes, results when the body doesn't produce enough insulin and is unable to use insulin properly, so there's insulin resistance. This form of diabetes usually occurs in people who are over 40, they're overweight and have a family history of diabetes, although today it is increasingly occurring in younger people, particularly adolescents. So how do people know if they have diabetes? People with diabetes frequently experience certain symptoms. These include being very thirsty, frequent urination, weight loss, increased hunger, blurry vision, irritable, tingling or numbness in the hands or feet, frequent skin, bladder or gum infections, wounds that won't heal, extreme unexplained fatigue. And in some cases, there are no symptoms. This happens at times with type 2 diabetes. In this case, people can live for months, even years, without knowing they have the disease. This form of diabetes comes on so gradually, the symptoms may not even be recognised. So who gets diabetes? Diabetes can occur to anyone. However, people who have close relatives with the disease are somewhat more likely to develop it. Other risk factors include obesity, high cholesterol, high blood pressure, and physical inactivity. The risk of developing diabetes also increases as people grow older. People who are over 40 and overweight are more likely to develop diabetes, although the incidence of type 2 diabetes in adolescents is growing. Also, people who develop diabetes while pregnant, a condition called gestational diabetes, are more likely to develop full-blown diabetes later in life. So how is diabetes treated? There are certain things that anyone who has diabetes, whether type 1 or type 2, needs to do to be healthy. They need to have a meal plan. They need to pay attention to how much physical activity they engage in, because physical activity can help the body use insulin better, so it can convert glucose into energy for cells. Everyone with type 1 diabetes and some people with type 2 diabetes also need to take insulin injections. Some people with type 2 take medicines called oral agents, which help the bodies produce more insulin and use the insulin it is producing better. Some people with type 2 diabetes can manage their disease without medication by appropriate meal planning and adequate physical activity. Everyone who has diabetes should be seen at least once every 6 months by their GP or endocrinologist. He or she should also be given periodically by other members of a diabetes team, including a diabetic nurse and an educator or dietitian who will help develop a meal plan for them. Ideally, one should also see an exercise therapist to help develop a physical activity plan, and perhaps a social worker in order to better deal with the mental side of having been diagnosed with a serious illness. and the stresses and challenges of living with a chronic disease. Everyone with diabetes should have regular eye exams. Once a year is recommended by an ophthalmologist to make sure that any eye problems associated with diabetes are caught early and treated before they become serious. Also, people with diabetes need to learn how to monitor their blood sugar. Daily testing will help determine how well their meal plan, their activity plan, and medication are working to keep blood glucose levels in the normal range. So what other problems can diabetes cause? Your GP will encourage you to follow your meal plan and exercise program, use your medications and monitor your blood sugar regularly to keep your blood glucose in a normal range as possible, as much of the time as possible. So why is it so important? Because poorly managed diabetes can lead to a host of long-term complications. Among these are heart attacks, strokes, blindness, kidney failure and blood vessel disease that may require amputation, nerve damage and impotence in men. But happily, a nationwide study completed over a 10-year period showed that if people keep their blood glucose as close to normal as possible, they can reduce the risk of developing some of these complications by 50% or more. So can diabetes be prevented? Maybe someday. Type 2 diabetes is the most common type of diabetes, yet we still do not understand it completely. Recent research does suggest, however, that there are some things one can do to prevent this form of diabetes. Studies show that a lifestyle change can prevent or delay the onset of type 2 diabetes in those adults who are at high risk of getting the disease. Modest weight loss, about 10% of body weight, and modest physical activity, about 30 minutes a day, are recommended goals. So if you have any questions, you can contact me through the live pharmacist on the website. You can email me or call into Lynchs Pharmacy in Cork. Thank you for watching and have a nice day.